Hi, my name's Diane and I'm a lactation consultant who works in a hospital in Tasmania, and this session is for you to get a brief introduction to breastfeeding. Most women come into our hospitals planning to breastfeed. Mostly what you need is some accurate information, lots of support and lots of reassurance. Most women have the ability to breastfeed. What they need is that support from the people around them, because the first few days and weeks can be a lot of learning for you and for your baby. In pregnancy, it's an opportunity to talk to your midwife or your doctor if there's anything that you are concerned about. There may be some medications that you're taking, or you may have a medical condition that makes you concerned that for you or your baby, breastfeeding might be a challenge. There aren't many medications and there aren't many medical situations where you can't breastfeed. One of the challenges for you might be previous breast surgery. And again, it's important you talk to your doctor or midwife, because most women, even if they've had breast reduction surgery, are able to breastfeed. One of the challenges for you might be your choice of labour or your plan for an elective caesarean section. And again, it's not very often that these cause a problem for breastfeeding. Your baby might be born a bit early, and the ability to coordinate sucking and swallowing and breathing starts for that baby at about 38 weeks of gestation. But even a little 36-week baby might be able to do it okay. The midwives in hospital will help you and support you if you need to do some expressing because your baby isn't quite ready to do breastfeeding by himself yet. It just depends on your baby and your situation as to what's right for you. Mostly what I want to talk to you today about is how to position and how to attach your baby. So during labour, you may have a long labour, you may have an epidural, you may have some analgesia in preparation for that birth. All of those things aren't going to have a problem for you when you're breastfeeding your baby. So once that baby's born, and here's my baby with her clothes on, she'll hopefully land on your chest. And there's plenty of time for her to get to know you, to smell you, to see you, for you to fall in love with your baby, ready for when she's ready for a breastfeed. And here's my breast. So what's going to happen is eventually that baby will start to show some interest in wanting to breastfeed. And she'll brush along. The darkened areola and the more prominent nipple helps her to find that breast. And with a bit of help from her mum, who might be holding her and cradling her in the crook of her arm, she's going to find her way to that breast. Now, it's important that we don't rush this. This might take an hour for your baby to rest and recover and then to decide that she's ready for a breastfeed. Once she starts heading in that direction and she's brushed past the areola and nipple a few times, she's going to start opening her mouth, and all you're going to do is help her to do what she's trying to do instinctively. She hasn't read any books, she hasn't even watched the video yet. She's following her instincts, and her instinct is to touch something, she opens her mouth. Something touches her tongue and her palate, and she starts to suck. And that's all we're trying to help her to do, is do what her instincts are telling her to do. So with a little bit of support of the breast and a little bit of support of your baby, she will find what she's trying to do. I'm not going to talk to you too much more about how to position and how to attach, because there's lots of places to go for that information. There's a really good website called Raising Children. It's an Australian website, and there's videos on there. So even if you're tired and can't read the words, you can watch those videos on how to position and how to attach. The Australian Breastfeeding Association have also got a really good videos and information on their website as well. But more about that later. When positioning and attaching your baby, there is no one right way. Lots of mums have got bigger breasts or smaller breasts, or their stomach is swollen. Sometimes even you might find that your baby in a twin position can be comfortable when your tummy is too swollen and too sore. The main key to this is that it shouldn't hurt. There is a tenderness associated with getting started. When your baby is first born, your nipples are very sensitive, and they need to be, because they're telling you when it feels right and when it doesn't feel right. So expect some tender tugging as that baby is suckling on your breast, but it should not be painful pinching. That's a sign that she is not attached properly, that she's just pinching the nipple. So you take her off, you tell her off, and you start again for a deeper attachment. The first few sucks as she's drawing that nipple in can be a little tender, but there should be a moment as she gets to the right spot. The other main important thing that you need to know about is that a newborn baby's stomach, when they're first born, is the size of a cherry. It's really small. Your colostrum is also a very thick fluid. There is no water in colostrum. It's thick and it's rich, and it has a whole lot of antibodies to give your baby immune protection, and it has some other things that will help to stimulate your baby's gut so it passes that first poo. By about 3 days of age, that baby's stomach is about the size of a walnut, and so about 10 mils per feed is all that she'll need. By the week of age, it's about the size of an apricot, and so a bit more food is needed then. But the good thing by then is that your milk has come in by about the 3rd to the 5th day after that baby's born, and the volume of water that's now in your breast milk has increased so that it's about 80% water, which is what your baby needs. Every couple of weeks your baby will have a growth spurt, and that means you'll have a few fussy feeds and a few fussy days. And that's quite normal. What she's trying to do is stimulate your milk supply, increase your supply ready for the next few weeks. And that's going to happen every couple of weeks for the first 6 or 8 weeks until that baby reaches a maximum capacity where their stomach is full. When they're a newborn, they're going to be sleepy. So for the first few days, they're only going to have about 3 or 4 feeds. And then on about the 3rd day, they wake up and they feed lots. So from about the 3rd and 4th day of life, they're going to feed about 10 or 12 times. Then the volume increases and their stomach capacity settles, and their appetite works out when they're full, when they've had enough, and when they can have a sleep, and when they're hungry again, when their stomach is empty. So you need to be reassured that your milk supply and your baby are working together to make your baby well satisfied, and to make sure she's got just the right amount of food and just the right amount of fluid coming from your milk. So be reassured that the first week, every day is different. From being sleepy for a few days to having a feeding frenzy for a few days, and then settling into a nice rhythm. Most parents, by about 2 or 3 weeks, start to recognise a rhythm and a pattern in their day. And most parents, by about 6 weeks, are getting to know their baby and getting to know the signs that say, I'm hungry, the signs that say, I've had enough, the signs that say, I've got a tummy pain, I'm tired, I just need a cuddle. All those things will become evident to you, but not in the first week. The first week is a whole lot of learning for you and for your baby. The other important thing for you to know is the signs that tell you your baby is well fed. Most commonly, we look for their nice heavy wet nappies. It's a basic truth that what goes in must come out. And so if a baby is well fed, not on the first few days, we expect to see 1 wet nappy on the first day, 2 wet nappies on the second day, but by the end of that first week, your baby should be having 6 to 8 heavy wet nappies each day. The other thing is their poos. They go from that black meconium looking product through a green and a brown. By the end of the first week, we're expecting it to look like liquid, yellow, mustard, seedy sort of stuff. Doesn't smell too bad, but there can be quite a bit of it some days. The other ways you'll know that your baby is well fed is that they're waking and demanding about every 3 hours. Sometimes it's only 2 hours since their last feed, and sometimes they'll let you sleep for 3 or 4, but not that often. The other things to look for is they've got bright, moist eyes, they've got a moist mouth, their skin is pink and healthy, and they're having some time awake during the day, although hopefully at night time they'll be having a good sleep, perhaps 2 or 3 hours if you're lucky. The other thing that some women ask about is special foods or special drinks that they need to have when they're breastfeeding. And the truth is that there is nothing special that you need to eat or drink while you're breastfeeding. There may be some foods that cause you to have an upset tummy, like too much cabbage or a really strong curry. So you might find your baby also has a bit of an upset tummy if you have too much of anything. But as a rule, there's nothing that you can't eat. Likewise with drinking, it's important that you are well hydrated. So having a glass of water every time you feed your baby is a good habit to get into. If you want to have a really strong coffee, preferably have that just after your baby's fed so that you're enjoying the effect of it, but it's long gone from your system by the time your baby feeds again. Likewise, there are other medications that you might need to take, or you may choose to have a glass of alcohol. Alcohol is not recommended while you're breastfeeding, but I'll let you decide what's right for you. With medicines, there may be a time of day when your baby has a longer sleep, and so it might be an opportunity for you to take your once a day medicine. Otherwise, if you're taking some paracetamol for pain, then you might take that just after you fed your baby so that you get the benefits from it, but your baby doesn't get too much when she feeds again the next time. One of the key things you need is support once you get home, and there's lots of places to go for that support. I'm hoping your family is around and able to help you. I'm hoping that your partner or significant person in your life is there to support you. While there's no need for you to hibernate in those early weeks, it's a really good time to just spend some time at home with you and your baby and those significant people that are going to be there to help you and support you while you get to know your baby and get into a good rhythm and a pattern with your breastfeeding. It doesn't take long for you to get to know your baby, but those early weeks are really important for that to happen. The other places to go for support are the midwives in the hospital, the child health nurses in the child health service. Your GP would be a good source of support. The Australian Breastfeeding Association has got a phone helpline, and there's lots of people out there and lots of places to go for good quality, accurate information. The last thing I want to mention is where to go for that extra help. So when you booked into hospital, you should have received a maternity information pack, a little booklet with lots of information in it. And there's information in there about breastfeeding as well. The Australian Breastfeeding Association has got a really good website, and there's information there, and there's a counsellor that you can talk to online there as well. The Raising Children's Network is a really good resource, and I would recommend you have a look on there because I have just done a brief introduction to breastfeeding. On that website, there is lots of information for you to read, as well as some video clips for you to watch about how to position and how to attach your baby. So I hope this information has given you a little bit of a glimpse at how breastfeeding gets started, and perhaps a little bit of information on those early weeks at home with your new baby. I haven't touched on things like sore nipples or things like increasing milk supply, but there are people out there that can help you if any of those sort of things happen for you. Okay, all the best in your breastfeeding journey, and I'm sure you and your newborn baby will get to know each other really well.